So the first thing I do if I get a wound in the wound clinic or I get a consult in the hospital is I want to clean that wound of any dead tissue, any infection, and any areas that are hidden. So what hidden means is like if there was a small hole in a big tunnel, because those are very difficult to heal. And that happens quite a bit. So one of the first things that I do for a wound is I'm going to, if it's not in good shape, is I'm going to debride it. And that could be something I do in the clinic or oftentimes I do in surgery. That's what I was doing this morning actually, was a wound patient in the hospital. The next thing I want to do to get wounds healed is I want to fix any external factors that could be inhibiting it. So there's a couple things that really stand out. One is diabetes.
Okay.
So obviously I can't cure you of diabetes, but I can control your blood sugars. So if you're diabetic and you have a wound and your blood sugars are 400, your wound is not going to heal.
Yeah.
But if you're diabetic and it's under control with either medicines or insulin, then your wounds can actually heal. So diabetes, smoking is a big one. Smoking constricts your small blood vessels and it really, really inhibits wound healing. So if you have a wound or a family member has a wound and they're a smoker, they really are kind of putting up a roadblock on themselves to heal. The last thing would be if there's any arterial issues. And so this is more for like wounds on the lower extremities or the feet. A lot of times as we age, just like our heart can get blockages, our arteries and our legs can get blockages. And so the blood flow is diminished to where the nutrients can't be sent down to the wound to heal it. So when we see patients with extremity wounds, mostly lower extremities, so like feet or lower legs, we'll run studies to see if their blood flow is okay. And I've had plenty of people come in with a wound that they say, oh, I've had this wound for a year and it won't heal, and then come to find out they have arterial blockage. We send them over to get that fixed, and then suddenly their wound heals. I mean,
cool.
that happens all the time. The next thing you want to do is stop any contamination. So this is mostly when talking about more like pressure wounds, like bed sores. A lot of these patients that are older have issues with continence, like urinary continence and stool. So if you get a wound that's getting urine and stool contamination frequently, I don't want to say you can't heal a wound like that, but it really, really makes it more difficult.
Yeah.
So there are things that you can do to control that. I mean, sometimes we have patients that are so infirm that we have to do things like get them a colostomy so that their stool is not, coming out where it normally does.
Yeah.
And sometimes it just has to be done, or you can't get them to heal. Next is you want to eliminate any swelling. So this is more for extremity stuff. Like if you have like a wound on your arm and you have swelling for whatever reason, more commonly the venous stasis where the legs get swollen, like you were talking about your family members, you said the right thing, compression. And compression can be applied many ways. It could be like a stocking or an actual dressing, but that's one of the first things that you got to do if you have extremity wounds is you want to get that swelling out. Next would be avoiding pressure. So this once again goes back to like decubitus or bed sores. A lot of those are pressure wounds. You sit in one location, you don't move, that pressure kills the tissue, and that causes the wound. That same effect will also inhibit wounds from healing. And so you want to make sure that if it's somebody who has a pressure wound that they're offloading, making sure that they're like shifting from side to side, either in a wheelchair or bed. This is something we have to teach patients that are paraplegic or quadriplegic, especially if they're, more recently like that, to take pressure off. Once you get all those things set up, then you can actually start the wound care. Now, I could talk for a full day about the different methods of wound care. There's a ton of products out there, but I will say that there are two things that we use most frequently. One would just be a standard saline or salt water wet to dry dressing. So you have a wound, you get some gauze, you soak it in saline, you put that wet gauze in there, you put a dry one over it, and you change that once a day. And that's a very, very effective way to treat wounds. And so like, if I was on a deserted island and, in the plane crash, I got a wound on my arm, I would take strips of cloth, I'd boil water, I would get that water, put it on the cloth, put it in the wound, and then change that daily. And you could actually get a wound to heal out in the wilderness by just following that very simple method. It's very effective. The other thing that we use a lot is a vacuum dressing. Have you guys ever heard of that?
Yes.
Yeah, oh cool. So vacuum dressings are newer technology, came out probably about 20 years ago or maybe a little bit before that. Actually, it's a little bit before that, 25 years or so. So it uses a sponge in the wound to which you apply suction, and then that sponge tricks the tissues into replicating. It has to do with the actual sponge pores, and when it's applied to suction, it causes those cells that it's in contact with to deform, and when those cells get deformed, it makes them replicate. So it tricks the wound into like filling itself. It's really cool. It's great technology. We use it all the time. The other thing with wound care is whenever you're changing that dressing, you do want to clean your wound with soap and water. I swear, there are so many even doctors out there that will tell people not to get a wound wet. And that is total nonsense. It is absolute nonsense. If you have a wound and you're treating it, cleaning it with soap and water is literally one of the best things that you can do because it'll get the bacterial count down. It'll get any cellular debris out that's inhibiting the wound. So cleaning with soap and water is very important. And then lastly, for our wounds, we consider is surgery something that they need. So can I just close this wound with some stitches? Do I need to put a skin graft on this? Do I need to do a flap? And that's once again why I think that the wound program we have is so good because a lot of wound care facilities don't have a surgeon running it. So if they find a patient that needs those things, like, oh, now I got to find a surgeon to send this patient to. And I can just do it myself. I just admit the patient to the hospital and take care of them. So, Wound Care 101. What do you think, Travis?
I've never heard of the other wound that you mentioned. I think Sarah said she had heard of it.
Which one?
What was that one that you had heard of just now, Sarah?
Oh, the venous stasis ulcer?
No, the suction.
Oh, the wound vac.
Yeah, the wound vac.
Oh,
I've never heard of that one.
Yeah, that's pretty new. I think most people that are not.
I didn't really know what it was. I just knew.
You've heard of it, yeah. Most people that are not in medicine, unless they had a family member that had one, would probably not know about it. It's just a more new, advanced type of wound care that's actually very, very effective. We use wound vacs all the time at the wound clinic.
Yeah. So like I have another wound story.
Bring it. I love wound stories.
So my
who
ex,
says that?
my ex got MRSA when
Okay.
he was in basic training, and he came.
Where? Where'd he get MRSA?
In Georgia.
No, I meant like where on his
Oh,
body?
right here.
On the leg. Okay, so he had a MRSA infection on his leg. Okay.
Yeah. So and it was an infection. So like there was just it looked like something had bit him, and it hurt really bad.
Oh,
Like,
yeah.
if he touched it or if I touched it, it
Painful.
hurt really, really bad. So I took him to the doctor, and they were like, "Yeah, that's that's a MRSA infection," and they just like literally dug
opened
it out, and I had to clean that thing.
So you did some wound care.
Yeah, I cleaned it every day.
Nice. Soap and
and
water?
I had to, and
Nice. You did the right thing.
what's that stuff that's in the blue? Hibiclin.
Hibiclins, yeah. So that's like an antibiotic.
He had to hibiclins his whole body every day so that it wouldn't
I
spread.
don't really. So I'll tell you.
They were
something.
like a very like he needs to
Yeah.
make
So,
sure it doesn't spread anywhere.
I mean, you guys have heard of MRSA, right?
Yeah.
Travis, MRSA?
I've not.
Okay, all right. So MRSA
not.
stands for methicillin-resistant Staph aureus.
Yes.
So Staph aureus is a bacteria that we have on our body. We all have it, okay? So in the old days, all Staph aureus was sensitive to penicillin or methicillin. And in the 90s, a new variant of staph came out that was resistant to penicillin. At the time, it was a big deal because there were not all of the antibiotics that we had today. And if you got a MRSA infection and it was bad, they couldn't treat it because there wasn't an antibiotic out to treat it. So MRSA was like a huge deal. Now, here's what happened. Over the next years and decades, MRSA completely replaced the standard Staph aureus to the point now that every single person, I think, in America has MRSA. If I know I have MRSA because I work in a hospital, but even like babies who are born have MRSA because their parents have it. So when people say that they now have a MRSA infection, it doesn't mean what it meant 20 years ago because now everyone has MRSA. All infections these days are MRSA. It's weird to find one that's not MRSA, but it's less important now because there's so many different antibiotics that will treat it.
Yeah.
Yeah.
Well, that's what they said, and so like I used to have to pack it too. They
pack
cut
the
it.
wound.
It was deep. It was like this deep in his
Right,
leg.
so you packed it with gauze. Yeah, so that's like a wet to dry dressing. You may not have had to put saline on it. Some of those packings have medications on them, like iodoform gauze is one. Was it strip gauze they use? Okay, it's probably iodoform.
Yeah, and then I had to wrap it up.
Yeah.
Every single day.
Look at you doing wound care. I'm gonna hire you at the wound clinic.
Yeah, it was good times. Good times.
Good times.